Behaviorism is the most popular theoretical study in psychology, and CBT is known to be a application that is based on behaviorism. In CBT, we look at the thoughts that the client is having. We look at how these thoughts are impacting their external world. And the patient's thoughts are largely as far as you can get with CBT therapy. We also look at potentially some of the physical characteristics that take place in certain situations. It's not necessarily a application that focuses upon the somatic experiences, and therefore an application such as psychoanalysis, psychoanalytic theory, object relations therapy are comprehensive theoretical approaches to treating psychological conditions that I would say are more needed and necessary in our contemporary probably than we've ever needed them before, merely because we live more sedentary lifestyles. We also spend a considerable amount of time with the use of these technological devices, and therefore there's the potential for a lot of stagnant energy, a lot of potential conflicts that are not getting released effectively because of our sedentary lifestyles. And ultimately, psychoanalysis and psychoanalytic theory is a whole and complete way of looking at our psychological condition insofar as we can denote a physical form of the self, a psychic form of the self, and a mental form of the self. And this is often not looked at in its entirety in our behavioral approaches. The behavioral approaches merely look at a surface level perspective of the human condition. So we're merely looking at our direct momentary existence. CBT applications do not go back to the client's history. They do not try to work with the philosophical underpinnings of a person's life. Insofar as how their environment has influenced their life choices and their object relations, such as their earliest associations with the maternal object, the paternal object. CBT applications are merely focused upon the fastest approach to treating psychological conditions, but they are a repressed and repressive form of psychological treatment in my perspective and in the perspectives of psychoanalytic researchers. Unfortunately, however, object relations has been denoted by some psychoanalytic scholars and researchers throughout the history of psychoanalysis as being more of a behavioral approach, merely because object relations signifies the other in relationships. It looks at the outside world as a means to understanding what takes place in the psychic life of the individual. Essentially, object relations are inherent in Freud's original drive theory, and therefore you cannot properly engage in psychoanalysis without recognizing object relations in the analysis. And so back in 1979, it was said by Harry Stack Sullivan, in regard to his critique of object relations, he would say that object relations was a weak term of compromise. Object relations, which was argued by Harry Stack Sullivan, who was actually a object relations contributor, argued that they are interpersonal relations and that the term allows its user to proclaim continued allegiance to the drive theory. Essentially, Sullivan's critiques of object relations comes from a need to maintain the integrity of psychoanalysis, because object relations is essentially almost like a branch or another way of expanding the works of Freud. Sullivan, I believe, felt it necessary to say that perhaps object relations as a extension of psychoanalysis needs to be protected insofar as it has to somehow relate to the original drive theory. We give it a interpersonal relevance, or we give it a interpersonal focus, especially I would say in the contemporary, merely because of our ease of access to behaviorism, because of all of the research, all of the studies that are out there on behaviorism, because psychoanalysis, psychoanalytic theory, and object relations goes back to the psychosexual stages and sees the object as merely another depiction of one's libidinal drive. There is not as much support in the contemporary because it is more of a physiological study of the mind that goes back to one's biological condition.